Well, some mothers-to-be right here in the Tennessee Valley are traveling to different cities to give birth. They say it's because their doulas aren't allowed in the delivery rooms in some major hospitals due to the virus, and one group is calling out Huntsville Hospital systems for a change. Our Sydney Stalworth talked to one mom who made the trip to have her baby.
With COVID, I can't imagine not having a doula. It was so scary. Having a baby for the first time was terrifying.
We talked with new mom Monica Baker, who gave birth in a Birmingham hospital in late June. As she leaves her follow-up appointment, she says she planned on giving birth locally and built a relationship with her doctor in Huntsville.
I would have stayed with him if I had been allowed to have a doula in the delivery room.
Baker ended up having a C-section and a difficult trip down to Birmingham for the delivery. She says the stress has taken its toll.
I might not have postpartum psychosis, and I might not have been at risk of harming myself and my child if I had been allowed to have a doula.
Sally Miss Kelly of Alabama Cohosh Collaborative says they've been hearing of more women leaving the area to have babies during the pandemic. They launched a petition calling Huntsville hospital systems to allow doulas who pass necessary health screenings into delivery rooms during the pandemic.
It lowers disparities. It's better for patients, especially when we're talking about birth doulas.
Huntsville Hospital sent a statement in response saying they will still continue to only allow one person to accompany a maternity patient.
Which is kind of, a hard choice if you're a laboring person. If you have to choose between maybe your partner or your spouse and a support person, that's a difficult choice.
Huntsville Hospital statement also reads, quote, because of the increasing community spread of COVID-19, particularly from asymptomatic individuals and the still unknown long-term effects of COVID-19, it remains medically necessary to use an abundance of caution to protect those who are among the most vulnerable. Monica Baker says it's time for change.
Huntsville is just behind the times, and it's hurting women, and it's putting them at risk, and it needs to change. We need to be allowed to have doulas, and this all started with me not being able to have a doula.
Putting the Valley first, Sydney Stalworth, WZDX News.
Even in normal times, pregnant women are constantly told to stay calm for their own safety and their babies, but in the midst of a pandemic, stress can be through the roof. Pregnant women are at elevated risk during the pandemic and can face anxiety and other mental illness during the age of COVID-19. And even after delivery, concerns exist. There's still a lot that's unknown about the risks of COVID-19 on newborns. We caught up with Alabama Cohosh Collaborative to talk about the stress.
Pregnancy can be a difficult time, especially labor anyway, but adding this layer on of a pandemic is really scary for a lot of people, and having emotional support is really important.
The CDC recommends not to skip your prenatal care or postpartum appointments during this time. Limit your interactions with other people as much as possible and consider breastfeeding your children during early stages.